If you find yourself staring at the ceiling at 3 in the morning, you're not alone. Millions of older adults wake up during the night, and while many dismiss it as just part of getting older, the truth is more complex and more interesting than that. Tonight, we're going to explore what's really happening inside your body that disrupts your sleep, and more importantly, what you can actually do about it. Let's start with something that might surprise you. Your brain physically changes as you age, and one of those changes happens in a tiny cluster of cells called the suprachiasmatic nucleus. This is your body's master clock. As you get older, you lose cells in this region. Fewer cells mean a weaker signal controlling your sleep-wake cycle. Think of it like an old radio that can't quite lock onto the station anymore. The signal gets fuzzy, and your sleep becomes more fragmented. Your sleep architecture also transforms with age. When you were younger, you spent more time in deep, slow-wave sleep, where your body does its heavy repair work. As you age, you spend less time in this deep sleep and more time in the lighter stages. Lighter sleep means you're more easily disturbed. A car passing outside, your partner shifting in bed, even your own body's internal processes can wake you up. You're sleeping closer to the surface. Now let's talk about something that affects a huge number of seniors, but often goes undiagnosed: sleep apnea. Some estimates suggest that up to 40% of people over 65 have at least mild sleep apnea. The muscles in your throat relax during sleep, and as you age, they lose tone. Your airway can partially or completely collapse. Your brain detects the drop in oxygen and briefly wakes you up to restart your breathing. You might not even remember these awakenings in the morning, but they fragment your sleep into pieces. Many people with sleep apnea never get diagnosed because they don't fit the stereotype. If you're waking up frequently and feeling unrested during the day, it's worth talking to your doctor about a sleep study. Then there's your bladder. Nocturia, waking up multiple times to urinate, affects more than half of men and women over 60. For men, an enlarged prostate often plays a role. For women, weakened pelvic floor muscles can contribute to nighttime urgency. But here's something most people don't realize. Sometimes your bladder wakes you up because you're already in light sleep due to other factors. There's also a hormonal component. Your body normally produces a hormone called vasopressin that reduces urine production at night. As you age, your body may produce less of this hormone, meaning your kidneys keep making urine around the clock. Let's move to something that becomes increasingly important as we age: chronic pain. Arthritis, back pain, neuropathy, old injuries that flare up. Many people find their pain worse at night because they're not distracted by daily activities. When you're lying still, every ache becomes amplified. Poor sleep also lowers your pain threshold, making you more sensitive to pain. It's a vicious cycle. Now we need to talk about medications. If you're over 60, chances are you're taking at least a few prescription drugs. Some medications directly interfere with sleep. Diuretics make you urinate more frequently. Beta blockers can suppress melatonin production. Corticosteroids can cause insomnia. Many seniors are taking multiple medications daily, and these drugs can interact in ways that affect sleep. If you've recently started waking up more at night, and you've also recently started a new medication, that's worth investigating with your doctor. Here's something that doesn't get enough attention: anxiety and rumination. As people age, they often have more to worry about. Health concerns, financial stress, loss of loved ones, questions about the future. These worries don't disappear when you lie down. Your mind is quiet, you're not distracted, and suddenly all those concerns rush in. Once you're in that mental state, falling back asleep becomes nearly impossible. This pattern can become conditioned over time. Your brain starts to associate waking up with worrying, and soon, you're waking up because your brain expects to worry at that time. Let's discuss your circadian rhythm. This is your body's 24-hour cycle that regulates when you feel alert and sleepy. As people age, several things weaken this rhythm. The lenses in your eyes become yellower and filter out blue light that's important for setting your circadian clock. Many older adults spend less time outdoors and get less bright light exposure during the day. The result is a circadian rhythm that's less robust. You might feel sleepy at 8 or 9 p.m., fall asleep early, and then naturally wake up at 2 or 3 in the morning having completed a full sleep cycle. Temperature regulation also changes with age. You might wake up feeling too hot or too cold. Women experiencing menopause often have hot flashes that jolt them awake. Even apart from menopause, older adults often have difficulty maintaining comfortable body temperature throughout the night. Now let's talk about what you do during the day. Physical activity and daytime light exposure have enormous impacts on nighttime sleep quality. Many older adults become less active. Less activity during the day means less sleep pressure at night. Your body builds up sleep pressure through a chemical called adenosine. More activity means more adenosine buildup, which means deeper and more consolidated sleep. Similarly, getting bright light exposure early in the day, especially outdoor light, helps anchor your circadian rhythm. It tells your brain clearly, this is daytime. That clarity makes the nighttime signal stronger too. There are also other sleep disorders beyond apnea. Restless leg syndrome becomes more common with age. This is an overwhelming urge to move your legs, often with uncomfortable sensations. It typically worsens at night. These movement disorders are sometimes related to iron deficiency, kidney disease, or certain medications. They're treatable, but first they need to be recognized. Let's address something psychological: the fear of not sleeping. Once you've had several nights of disrupted sleep, you can develop anxiety about sleep itself. You go to bed worried that you'll wake up again. That worry activates your stress response, releasing cortisol and adrenaline, which makes it more likely you will wake up. It's a self-fulfilling prophecy. Now here's something important to understand. While age-related changes do affect sleep, sleeping poorly is not an inevitable part of aging. Yes, your sleep changes, but waking up multiple times every night and feeling exhausted every day is not normal at any age. The changes we've discussed are real, but they're also manageable in most cases. So what can you actually do about all this? First, consider your sleep schedule. If you're going to bed at 8 p.m. because you're tired, you might simply be finishing your sleep by 3 a.m. Try staying up a bit later. Give yourself a more realistic sleep window, perhaps 11 p.m. to 7 a.m. Second, maximize your exposure to bright light during the day, especially in the morning. Go outside for a walk, sit by a sunny window. This helps keep your circadian rhythm strong. Third, create an ideal sleep environment. Keep your bedroom cool, between 60 and 67 degrees. Make sure it's dark and quiet. Use blackout curtains if needed. Invest in a comfortable mattress appropriate for any pain issues you have. Fourth, be strategic about fluid intake. Front-load your hydration earlier in the day. Reduce fluids in the 2 to 3 hours before bed. Empty your bladder right before lying down. If you wake up to use the bathroom, use dim red lights rather than bright overhead lights. Fifth, review your medications with your doctor, specifically with sleep in mind. Ask whether any might be affecting your sleep and whether timing adjustments or alternatives might help. Sixth, address pain proactively. Work with your doctor to find pain management strategies that help you sleep. This might include medications, physical therapy, or gentle stretching before bed. Seventh, if you wake up and can't fall back asleep within about 20 minutes, get up. Don't lie there struggling. Go to another room with dim light. Do something calming, and only return to bed when you feel sleepy again. Eighth, consider cognitive behavioral therapy for insomnia, often called CBTI. This structured program helps you change the thoughts and behaviors that prevent good sleep. It's highly effective for older adults, often more effective than sleeping pills, and the benefits continue after you stop the therapy. Finally, talk to your doctor about a sleep study if you snore, gasp during sleep, wake up with headaches, or feel excessively tired during the day. Sleep apnea is treatable, and treatment can be life-changing. The bottom line is this: while your sleep does change as you age due to real biological factors, you don't have to resign yourself to poor sleep. Understanding what's actually happening in your body is the first step toward better nights. Most causes of nighttime waking in seniors are treatable or manageable. Good sleep is worth fighting for at any age. It affects your physical health, mental health, cognitive function, and quality of life. You deserve to sleep well, and in most cases, with the right approach, you can.